Greetings students and welcome to week 5 of STED 185. Thus far in the course, we have looked at the perceptions of persons with special needs and have come to understand that diversity is an inherent part of humanity and thus we all have special needs. For the purpose of service provision, labels are assigned to some exceptionalities. So for the past weeks, we have looked at some high incidence disabilities, and this week as well as the next, we'll be looking at low incidence disabilities. Now, broadly defined, low incidence disability is one in which the rate of occurrence is extremely small, so that persons with low incidence disabilities require highly specialized services, equipment, and materials. But I want you to be mindful too that even persons with low incidence special needs have a rightful place in the inclusive setting. The objectives for today's session are 1. First, to understand that special educators working in inclusive settings often serve students across disability categories or students with a wide array of educational needs. 2. To describe and discuss the prevalence and characteristics of students with autism spectrum disorders. 3. To describe and discuss the prevalence of characteristics of students who are deaf and hard of hearing. 4. Describe and discuss the prevalence and characteristics of students with low vision and blindness. And 5. For us to be able to recommend accommodations and modifications that promote inclusion of students with lower incidence disabilities. As we begin, I invite you to look at these pictures and think about how easily you can spot their differences. In all of the pictures shown, you are able to identify that these persons have some sort of special need, yes? And some of the disabilities are more recognizable than others. For example, starting from the left, if we look at the second row, the third picture, the girl who's using the inhaler, you may not have been able to recognize that she has a special need. If it is, she was not using the inhaler. So we realize that for persons with special needs, it's not always easily identifiable. And for some of the low incidence disabilities that we'll be looking at, especially in today's session, for many of them, it may not be that easily identifiable unless you pay close attention. So let's take a look at autism spectrum disorders. Now, a diagnosis of autism is made on the basis of observed behavior. So there are no blood tests, no single defining symptom, and no physical characteristics that are unique to autism. So that clinicians, psychologists, or medical practitioners must use careful observation of behavior to determine whether a student's difficulties are related to autism or are better described by another condition. There are 3 separate diagnoses for autism spectrum disorders that have been used in the past, and these were PDD, which stands for pervasive developmental disorder not otherwise specified, autistic disorder, as well as Asperger's syndrome. But with the revision of the Diagnostic and Statistical Manual, and with the newest version or the latest version being the DSM-5, all 3 categories have been merged into a single diagnosis, now known as autism spectrum disorder. There are now 2 domains rather than 3, and the new domains are social communication and restricted and repetitive patterns of behaviors, interests, and activities. The behaviors in each domain may be present currently or on history given by parents or other relevant persons. Behaviors exhibited in the two domains can result in autism spectrum disorders ranging in severity from mild to profound. And what is significant is that the characteristics must be noted in the very early years. It's important to note that autism spectrum disorder may be comorbid with other disabilities such as ASD, such as attention deficit hyperactivity disorder, anxiety disorder, and specific language disorders. The characteristics of ASD present themselves differently for each individual, and the causes of it are still not well understood. But most experts would agree that ASD is a neurobiological disorder and that it has a genetic basis. In terms of classroom application, it is important to recognize that the characteristics that will be displayed in terms of repetitive behaviors, social communication, those are the ones that would need to be addressed in the classroom setting. And so functional behavioral assessment has to be done by the classroom teacher in order to plan intervention. In the classroom environment, intervention must promote language and communication. There must be a predictable routine. Approaches to challenging behavior must facilitate transition planning as well as social interaction with others. And of course, support in terms of accommodations and modifications inclusive of technology will have to be used. We move now to another disability category. Now, I am not sure if you have heard the term sensory impairments before. However, sensory impairments involve any of the five senses. For educational purposes, though, it generally refers to a disability relating to hearing, vision, or both. And low vision and blindness, as well as deaf and hard of hearing, fall under the umbrella of low incidence disabilities. Let's take a look first at deaf and hard of hearing. So people who are deaf have a profound hearing loss. They have little use of hearing, even with the use of a hearing aid. Deafness can be divided into three groups, meaning that a person can be congenitally deaf, and that occurs when hearing loss has been present at birth. Prelingually deaf, meaning that before the development of the ability to speak, the person has been unable to hear. And postlingually deaf, which refers to loss of hearing after the development of the ability to speak. Hard of hearing refers to losses that impair a person's understanding of sounds and communication. So it means that that person has residual hearing. They are able to hear a little, but they are not able to hear very well in order to be able to understand speech clearly and to be able to communicate effectively. So how does hearing occur? Sound waves catch the outer ear, then it goes into the middle ear, which turns into vibrations. The inner ear produces electrochemical signals that are sent through the nerve cells along to the auditory nerve, and then our brain perceives those signals and makes meaning out of them. For a person with conductive hearing loss, it means that sound waves cannot travel to the inner ear. Now, just now when we went through the process, we realized that the outer ear would catch the sound waves and turn it into vibrations. So a person who has conductive hearing loss, it means that somewhere between being able to catch the waves and turn them into vibrations in the middle ear, there was something wrong with that process to impede hearing. For a person with sensory neural hearing loss, it means that there would have been some sort of damage to the inner ear or the auditory nerve. There is a differentiation between deaf with a capital D and deaf with the common D. Persons who call themselves deaf, and they prefer that term, and when we talk about using person first language, meaning that we are putting the person before the disability, so that we would say maybe the boy with autism rather than the autistic boy. In the deaf community, they prefer that they are called deaf. So it's all right for a person who is deaf to say the deaf boy. These members consider themselves as part of a community, and they consider themselves to be a minority group. Persons who are deaf use sign language. ASL stands for American Sign Language, and that's their primary mode of communication. And they do not use oral communication. A person who considers themselves to be deaf with a common D, they are the ones who are born of hearing parents, and they sometimes use oral communication as their mode of communicating with others. Hearing loss can be classified as mild, moderate, moderately severe, severe, and profound. And with hearing loss, the most important consideration is whether the loss occurred before or after the individual developed oral language. Now, there are some known causes of deafness or a person being hard of hearing, but most of the causes are sometimes unknown. Heredity and genetics, diseases, bacteria such as meningitis, otis media, which is air infection, as well as noise, are all contributors to hearing loss. In order for these to be prevented, measures such as noise abatement and immunization must be taken. For working with students who are deaf or hard of hearing, it is important to use strategies such as facing the student whenever you're speaking so that you'll ensure that you're in the line of sight. Avoid standing in front of bright lights and maybe like something like a window, and be able to provide accommodations such as handouts and writing announcements and notes rather than just using speech as the primary method of communication. We move on now to visual impairments, and these can be divided into two subgroups, low vision and blindness. A person who has low vision has a loss of vision that cannot be fully corrected through surgery, pharmaceuticals, glasses, or contact lenses. And a person who is blind is unable to see and has no useful sight. Now, students who are blind differ greatly from students with low vision, as many of these individuals do not read print, but they have printed material translated into non-print formats, such as recorded voice, print-to-speech, or braille. They typically use aids to move around independently, and for some, learning how to socialize and interact easily with others does not come easily. The most common causes of blindness and low vision among children are complications caused by premature births, heredity, and accidents. And in the classroom environment, teachers would want to ensure that accommodations such as the use of assistive devices, as well as orientation and mobility instruction, as well as things like magnifiers, or highlighters are used to assist students with their sight. So this is where I'll leave you for today. I encourage you to read this week's lecture notes and participate in the discussion.